All right, so I want to give you a quick little explanation of disc mechanics and how the spine specialist helps patients all over North America get rid of their back pain. This here is a spinal segment. Vertebral bones, lumbar disc, and nerves here, the yellow part. Over time, and as the spine begins to age, you lose space between those bones. The disc here shrinks. The disc is made up of what's called concentric cartilage. There's basically like duct tape wrapped around a soft center. So if you can visualize duct tape wrapped around a jelly donut, what happens over time is the outer layers get stretched from pressure. Sometimes they tear, sometimes they bulge out like that into the nerve, and the fluid can leak out over time. What happens when that fluid leaks out? A couple different things. You're putting pressure on these nerves. You're putting pressure on the bones because it gets to a point where you can get bone on bone. The disc gets so thin. The other thing that happens is the disc becomes unstable. So look at it like a car tire. If your car tire loses air, you know what happens to the car. You take a corner and the car floats this way and floats that way because it's unstable, because less air means the tire is less tight, so it's not nice and stable. It's actually losing its stability. That is why most of the schools of thought around fixing back pain are strengthen your core. And you go to every physio, you go to most chiropractors, you go just about anybody that you talk to that deals with back pain, the answer is to do exercises and stretch your core. Well, to me, it helps. Sometimes, though, it's just a Band-Aid, because if you've got an unstable joint like this, strengthen everything around it, makes it more stable. What if the muscles are tired? What if they eventually get weak again? What if you don't continue doing those exercises forever? It's going to get weak again, and this instability gives you a problem. So what if there was a way to improve that stability in the spine the way it was designed to do? There is. Traction the spine, use laser to increase the circulation, to reduce the inflammation, to make the disc more permeable. So open up the pores in the disc, and that when we stretch it, the fluid around will get sucked back into the disc. If there's any bulge, if I have pressure on the disc, there's a bulge. If I release the pressure, the bulge gets sucked back in to where it's supposed to be. So instead of worrying about strengthening the core as the only solution, why not pump the tire back up so it becomes stable again? Real simple concept. That's the way it should be. Keep the core strong, strengthen the core, but also address the root of the issue, which is not always muscle weakness. It's actually a squashed disc becoming unstable. That's about as simple as it gets. We can help you do that with the spine specialist. There are locations across North America. We look forward to helping you get better and back to the life that you deserve. Thanks so much for watching. I hope this explanation gave you a little bit more information about disc mechanics and how it makes complete sense to decompress a disc with laser therapy. Thank you very much.